Hi, everybody. Welcome to this very interactive session with uh, the medical director, and founder of Manoshanti, Dr. Rishikesh Behre. Dr. Rishikesh, welcome to this session. How are you doing today?
Yeah, thanks, Ketan, for hosting me. And yeah, I'm good. How are you?
I'm doing good. So, Dr. Rishikesh and his team run one of the top mental health centers and hospitals in across almost 9 cities in India, 9 centers across 4 cities in India, and today, Dr. Rishikesh will be uh, talking about his journey. He'll be going deep into what made him start Manoshanti, what are the approaches behind how they treat patients at Manoshanti, and it's basically a very deep dive into what makes Dr. Rishikesh and Manoshanti click. So if you're ready, Dr. Rishikesh, we would like to would love you to introduce yourself and introduce and talk about your role at Manoshanti and what inspired you to choose this very interesting field of mental health, very neglected but very important in today's world.
Yeah, so as I said, I'm Dr. Rishikesh Behre. So I'm a psychiatrist by training. So I did my MD in psychiatry from the National Institute of Mental Health and Neurosciences, Bangalore. And since then, now I've had over 20 years of experience working in the field of mental health. And I was also an associate professor at Kasturba Medical College, Manipal. And besides that, I've also done a research fellowship which is sponsored by the Wellcome Trust UK and the Department of Biotechnology. So, I mean, I've come from a fairly like an academic background with a lot of interest in research. So, what my experience is being in an academic field and a research field, and also having worked so many years in the mental health space, what I realized is that there is a lot of gap in mental health care presently in India. There are a lot of people who require mental health care and services, and either they are not able to access it, or a lot of people have mental health issues but are not aware enough to that they have these issues and they need to seek help. So on both these fronts, there is a gap. What we also observed is that in the mental health space, the care that is available is very fragmented. Like there are some apex institutions like the Nimans in Bangalore, and similarly there are institutes in the north of India. But largely, if you look at the availability of mental health care, it is either through individual practitioners spread across different cities and of India. And especially if you come to tier 2, tier 3 places, the frequency and availability of these experts in mental health gradually diminishes. So that way, because of this fragmentation of services, a lot of people do not know whom to approach, where to approach. Okay, and people need to be assured that they will get quality mental health care. So with this idea, me and my colleagues, Dr. Naren and Dr. Girish, we came up with this idea of starting Manoshanti centers across different places in India, which would operate under the same umbrella. The idea of having the same umbrella is that there would be uniformity and standardization of the clinical care that would happen across all the centers, so that any Manoshanti center that a patient accesses treatment would get the same standard and quality of care across. So that's our primary philosophy.
Wonderful. So also, what conditions do you primarily specialize in, and how do you describe your approach to treatment? You kind of cover that in your earlier message, but just wanted to dwell a little bit deeper into that.
Yeah. So at Manoshanti, we believe that all psychological and psychiatric services should be available under one roof. So people do not have to kind of shuttle between different people in different places to get the services that they require. So we cater to all psychological and psychiatric conditions under one roof, and catering to all age groups, starting from children to adolescents to adults and old age, as well as all mental health conditions that may affect either genders. So primarily, so if you look at the child age group, you have people with developmental conditions. There may be children who have autism or ADHD, who may have emotional problems, who may have learning difficulties, who require support. If you look at adolescents, adolescent depression is a very upcoming. I mean, the incidence of that condition is yeah, increasing a lot, and we are also getting to see a lot of adolescents with emotional problems, given the social situation that and the society we live in today. A lot has been already said about stress, anxiety, depression that happens in adulthood. We also cater to people with relationship problems, offer counseling for relationship problems. And so our primary focus is mainly emotional well-being. So it's not only about treating the psychiatric condition, but it's also identifying people, before they develop a clinical condition. And we believe that if we can identify people who are at risk and in general improve the emotional well-being of people, the incidence of mental health conditions in future can reduce. So that is a focus that we have. And when it comes to elderly, depression in the elderly is rising. Also, as we know that the elderly population in India is increasing, so people are living longer into their 80s. So we are seeing an increased incidence of memory problems like dementia. So that is another population that we cater to.
Great. An interesting question just to follow up on what you said. I think in this, especially in mental health, I think any doctor and patient relationship, I think the trust factor is very important, specifically in mental health, because I think, it takes a lot of, a lot of trust for the patient to confide in the doctor and really go, and especially in a country like India, in our culture, where people generally, it's taken as a stigma or some in our culture, unlike in the West, where people approach a doctor, but here people are hesitant, specifically for mental health, because there's a stigma associated with it. So I think the trust factor is very important. Now, just on a follow up on that, how do you balance this evidence-based medicine with compassionate care, and how do you actually build that trust with the patient, which is very important?
Right, I think, with that question, I think you have hit the nail on the head, and kind of that also defines you asked a question about clinical approach and our, that is a cornerstone of our clinical approach, right? So, trust and confidentiality. Okay. So when somebody reaches out to seek help, so our evaluation involves a thorough clinical, medical, as well as a psychological evaluation, taking into context all the factors that can influence a mental health condition. So mental health is influenced not only by an individual's factors, but also that individual's environment and the kind of interaction with people that the person has. So we take all that into consideration in our comprehensive assessment. We also ensure that we give adequate time for these assessments. So a typical consultation would last at least 30 to 40 minutes, because what we've realized is giving time for a person to open up and to be comfortable, establish rapport with the consultant is very important, because without that they will not feel the comfort level. So we ensure that we give adequate time for the consultation. And plus, along with that, then we also believe that the treatment options need to be discussed with the clients, and it is the client who leads us, into what kind of treatment options that they are comfortable with. We provide them with the scientific evidence base for the different treatment options, and what, as per our professional opinion, we believe is going to help the patient best. And it is like a mutual, kind of a collaborative approach that we have with the clients, wherein so we believe that the treatment process is like a journey, right? So which needs to be wherein we help the client to cross that path from a distress to a phase wherein they are on their path to recovery. So it's like a journey that we help them. So I think, and that is where I think the balancing that treatment options with the best evidence, scientific evidence, while at the same time ensuring the comfort level of the clients being available and approachable when they have questions and when they have doubts. I think that's how we balance care.
That's great. Also, what do you believe makes Manoshanti unique in the mental health care ecosystem? It's slightly fragmented. There's a lot of players in there. So, what makes you unique? And also, what do you think patients appreciate the most about your team environment?
Yeah, so I think what makes us unique is A, that Manoshanti is a clinician-led kind of a service. So it is a clinician who understands the best about what is required for patient and client care, and what are the challenges that the clients face. And so given our rich experience that we have over the years and the training that we have received, so we kind of try and put that into best use to come up with novel and innovative solutions. The other thing that also makes Manoshanti unique is we also believe, in translational care. That is because the three of us have been active into research and academics. So translational care means that the benefits of research should translate into good clinical care. So using the best of research evidence and translating that into good clinical care, that is something that makes us unique. We also believe that the recent advances that happen in the field of mental health care should get translated into clinical practice. So at Manoshanti we offer all the advanced treatment options that are available anywhere in the world, which includes newer treatment options like brain stimulation therapy, ketamine infusion therapy, as well as harnessing technology such as virtual reality therapies. So, any advancements and anything that is latest in the field of mental health care, we bring it into our clinical practice in Manoshanti, and I think that's something that makes us unique.
Great. And what can a patient expect in their first session with you? I mean, what kind of concerns do you commonly address for a patient that comes to your clinic online?
Right. So commonly, I mean, we would get people who are experiencing any kind of psychological distress. So this could this could include any kind of stress symptoms, such as a lot of times people have physical symptoms which are misinterpreted as to be a physical condition. So for example, somebody may have palpitations in their heart, which may be mistaken to be like a heart condition, or some people may have some stomach symptoms which are being treated for a long time but not improving, but actually they are because of stress-related condition, or they may have symptoms which mimic a neurological conditions like some pain in any part of the body, or migraines, or headaches. So a lot of times these are related to stress. Some people may experience cognitive problems such as lack of focus or attention in their work. People may experience problems in sleep, so any kind of an disturbance in their sleep patterns may be an early sign of an underlying mental health condition. Then there is a section of population who have difficulties adjusting to their environment around them. It could be the work environment, it could be a family environment. They may have interpersonal problems, maybe with their spouse or with their partners. So that's another the group of people whom we deal with. And so the approach would be, so when somebody comes in, to give them a safe and confidential space which is non-judgmental, wherein they can feel comfortable and open about their feelings and emotions, and share their distress. And Our consultants will offer them an empathetic listening, wherein there's somebody who can listen and understand their distress. And then we do our clinical evaluation and see whether the person has an underlying clinical condition which requires treatment. Many times it could also be subclinical conditions, which then do not require conventional treatments, but they do well with supportive psychotherapies, which is then offered to them. Certain conditions which then have clinical. So primarily, I mean, the first level, whether somebody has a clinical condition or a subclinical condition, that is an evaluation that we do, and followed by if some depending on the condition, some people require more advanced psychological assessments to get a deeper understanding about their personality, about the factors that are contributing to their distress, to kind of clinically diagnose whether somebody has a clinical condition. If there is a condition, how severe is that condition, which then helps us to plan their next steps of therapy. What is the kind of therapy that they would benefit with? What should happen in the therapy? So that is typically a process that would be followed.
I think that's very important. The patient care and experience that you provide, I think that's really the differentiating factor. Now you mentioned about the initial diagnosis, right? But a couple of other important things throughout, because I assume that it's a journey, right? It's not apart from the initial consultation, the initial diagnosis, and it might take, I don't know, anything from maybe a couple of days or weeks to even months depending on the complexity of the condition. So how do you support patients through their entire recovery journey, apart from the initial period that you mentioned, and also more importantly, what advice do you give families or on supporting someone with mental health concerns, because it's also important for the family of the patient who is also experiencing them. So how do you help that as well?
Yeah, so as I mentioned, that recovery is a journey, and and it's a path that we take along with the patient or client to along that to reach that recovery. And in that path, it's important to take all stakeholders along. So it could be a person's employer, it could be school or teachers, it could be parents, it could be other caregivers. So an essential component of our the treatment journey is not only working with the client, but also working with the people that the person is in contact with, like an immediate family, to work with them and see how they can provide a conducive environment that facilitates this journey to be done faster. So usually what happens is that a lot of times the caregivers or the families do not understand that the distress that the individual is going through, because a lot of time because the mental health distress is something which is very personal, and that is something that only the individual can understand, as opposed to a physical condition where the pain is visible to others, or for example, if you have a physical condition, you can do like an MRI, or you can do a test and show that there is a problem. But mental health distress is something which is very personal, and it's not something which can be communicated very easily to the others. So it's very important for the people around them and the family to understand the distress that they are going through, not to be dismissive of that person's distress, and to be available to support them, listen to them empathetically when it is required, and provide the support and care that they need. So we also take families on board on this journey, so that path to recovery can be faster.
Great. So we often see that patients have a lot of preconceived notions or myths, or basically lack of knowledge around the mental health care process in general. So are there any of these myths that you often have to debunk in your consultations?
Yeah, unfortunately, mental conditions are associated with a lot of stigma. People don't see physical health conditions at the same level as mental health conditions. So that has constantly been a focus of all mental health advocates. That we need to start understanding that mental health conditions are real, that these conditions also cause significant distress, and that they're on par with physical conditions and need to be given equal kind of attention. So because of this stigma, yes, there are a lot of myths. The common myths that we encounter are that mental health conditions do not exist; it's just in your mind. B, a lot of stigma is associated with medications which are used in treatment of psychiatric conditions, such as that they are addictive, they are harmful to the body. Once you take them, you have to take them lifelong. These are very common myths that we encounter. And but however, to the contrary, I think the people need to understand that the mental health distress is the prevalence of mental health conditions is actually far greater than physical health conditions. Like for example, the prevalence of diabetes is around 7%, but the prevalence of depression, anxiety is 15%. It's almost double that of diabetes. But all the focus we give is to preventing sugars, checking your cholesterol, your heart condition, and things like that. But the amount of attention that goes to early identifying conditions such as depression, anxiety we don't put as much effort. Also complicating the factor is that earlier it used to be Google and now it is ChatGPT. So people there is a lot of misinformation about that is available on the internet. So we encourage people to come in with their myths. We ask them specifically if you have any questions, and that we are available to answer that. We encourage them to share any material that they have read with us, so that we can also critically evaluate it, and and we can give them, we can guide them to the right resources to read. Because for example in ChatGPT, it all depends on the type of question you ask. If you give a wrong prompt, you will get a wrong answer. Same with Google search, what sites to access. So we encourage, we are not dismissive of people's need to do their own research and find answers to that, but we encourage them to share what they have read with us, and so that we can have an open engagement and discussion.
I mean, you hit the nail on the head when you said self-diagnosis on Google and ChatGPT. Now, let me come to a very fundamental question, right? When do you think someone should seek professional help? When do you think that, at what stage, whether the patient or somebody related to the patient, family or friends, who think that both, right? If they, where is that? When do you think, and what is the signs that they should seek professional help?
Yeah, I think you've asked a very important question, because it's very important for people to be aware that when to seek professional help. Right. So the one thing that we tell everybody is that the one indicator that the distress that you're experiencing, one yardstick to measure is that if it starts interfering with your day-to-day functioning levels. Right. So for example, somebody has lost a job, they feel sad about it. We tend to use sadness and depression in layman terms very interchangeably, but they are not the same. Okay, so somebody has lost a job or has had an argument with somebody, they may feel sad about it for some time, but it does not affect their ability to function. They will still go on about their day-to-day work, and the sadness may last for some time, and then they overcome it, and then life goes on. But what happens when there is a clinical condition such as depression is it starts impacting their ability to function in the day-to-day life. Right. So either the emotions that they experience may be out of keeping with the situation, right, or the dysfunction that happens is much more greater than what it should be. So any kind of a change from your normal daily functioning that you experience because of emotional distress, that is a sure shot sign that you need to seek professional help. Right. And the other indicators are what we call as biological function. So things such as sleep and appetite. If a sleep disturbance is usually a first sign of an underlying condition that is going towards a clinical condition and needs to be identified early and treated. similarly, either it could be a decrease in appetite or it could be an increase in your appetite. Again, in terms of functioning, it's not necessary that the functioning only that the functioning is affected. It could be the other way around also. So you have somebody who is, for example, a very good a worker, always does things on time, but nowadays is slipping, is not being as efficient, and is not able to function as much as he was doing earlier. That's a sign. But at the same time, somebody who was not very good at their functioning, very not good at their work, was average, but suddenly you find that they are doing very well, they're very social, talking to a lot of people, so any kind of a change from the ordinary, okay, which impacts the person's functioning, and combined with some kind of a biological function disturbance either in sleep and appetite. So these are some short signs that you should seek professional help.
I couldn't agree with you more. I think that we sometimes just underestimate simple issues like lack of sleep or appetite. It could be a gastrointestinal problem, or it could be just a little bit of tiredness. But very important points. I think it starts small, but you really need to understand your body a lot better. So very important points, doctor. And now, on that, how does a typical treatment process look like for the disorders you manage? Now that you mentioned about, what when they should approach. So when they approach, how does the process look like? Of course, it might vary. I understand, from depending on the condition, depending on the diagnosis, depending on the age, multiple factors. I understand that. But generally, what does a treatment process look like? If you look at it from a bird's top level perspective, just for understanding from a layman perspective as well.
Yeah, so a typical treatment process would start with a first consultation, where the first consultation is like an opportunity for the individual to share their emotional distress in a safe, non-judgmental and a confidential environment, where they can feel open to share their experiences and what is happening to them. And that would then be combined with our own clinical evaluation about signs and symptoms, to see whether somebody has a clinical condition or is it something like a subclinical condition. And also we make our own assessment of what are the environmental factors that may be contributing, whether there are any other medical conditions that may be contributing, whether any evaluation is required for that, whether any if we feel that there is a need for a further psychological assessment, then we advise that, which gives us a deeper understanding about their, it could be personality factors, it could be environmental factors, which may help us to understand whether there is any diagnosable clinical condition. If it is present, how significant is it? And all these factors then lead on to then deciding what are the treatment options. So the treatment options usually are psychotherapy, which includes helping an individual through their maze of emotions, how to cope with their emotions, developing strategies and skills to be able to deal with situations, preventing these from occurring in the future. Certain conditions require support of medications. If that is required, then we discuss the options with the patients. And some people who are not responding to conventional treatments require additional forms of treatment, such as brain stimulation therapies. Certain conditions benefit with cognitive enhancement therapies. We also employ technologies to harness technology and use advanced interventions like virtual reality therapies. So that is decided then on a case-to-case basis based on the clinical condition and the results of the assessments.
Maybe I'm asking you a little bit of a silly question, but can recovery truly happen? And how does that recovery process look like? When do you say that somebody is truly recovered from a condition? See, people, when they are facing a mental condition, they it's obviously going to affect their functioning as well, right? Things look in despair. Things don't look very positive. So does recovery happen? How does recovery look like from a clinician's perspective and also from a patient's perspective?
Right. So recovery is a very relative term, right? So what more than recovery, I think what the term that we should use is functioning. So the idea of the any assessment or any therapy or any medication or any form of treatment that we would use is to get the patient back to their functioning levels in a way, so in which they are making a meaningful contribution to themselves and the society, right? So and being well adjusted with the environment around them, so being able to function without too much emotional distress. So that is, if you have to use the word recovery, that is the definition of recovery. Okay. In some people, it is possible to achieve that over a period of time with medication, with therapy, and there may come a point wherein the medication can they can get off medication and maintain that same level of functioning and recovery. In some people, it may happen that they require some extended support, which may be in the form of therapy or medication or a combination of both. Right. So what we generally tell patients, not important whether what is important is whether you are getting back to your functioning levels, and that is the yardstick that we need to use. So in our experience, in most cases, yes, it is possible to achieve that fair degree of that recovery and functioning. In many cases, it is possible to come off treatment medication. That is the ultimate goal, right? And even if in some cases they require continued medication and support, but if as long as that helps them to maintain that level of functioning and recovery, so I think that is more important. So the example I usually give people is, like, for example, that if you have somebody with diabetes and hypertension, right? So in these cases, you need to take long-term medication. You need to implement those lifestyle changes in terms of your nutrition, your diet, and your regular physical exercise. By doing that, you can manage your condition, keep your sugar levels under check, keep your BP levels under check. Right. So this is also something like that, wherein by implementing the changes that you need to make in your, it could be your lifestyle, it could be your approach, it could be your perspectives, it could be your outlook to things, implementing the strategies that are discussed in therapy. It's like a lifestyle change that you need to bring in without medication. And so that's how a typical journey would look like.
Just to add on to that, I think you covered it in one of your earlier answers, but again, a very important point which brings back to me about how do you ensure that your patients feel safe, understood, and not judged? Do you actually train your doctors and counselors? Is there a way you approach them? How do you, because you know, when they go to a doctor, I think that's again comes back to the same thing, compassionate care. You mentioned about it in one of your early answers. So again, how do you ensure that trust factor is what I'm trying to ensure is from the patient, from the doctor's side? Do you actually provide training? Do you actually, is the way, or do you have in your hiring process, in your filtering, do you take your doctors through a very human element of care as much as the physical and the the psychological component of it? So can you shed some light on that?
Yeah, I think that's a very important point that you have touched upon. So, as mental health professionals, it is a very important part of our training. How to be empathetic, how to be non-judgmental, and how to maintain and ensure confidentiality in all our interactions. So that is a cornerstone of any relationship that a mental health professional has with their client. So this is something which is inculcated by years of training, and we have also inculcated this training as a part of our philosophy in Manoshanti. So an example of that is that we run a training program called as a Training Initiative for Psychiatry Postgraduates, TIPS. So this is a very popular program that has been running for the last 10 years, wherein we train postgraduate students of psychiatry in basic skills of interviewing and how to do a mental health evaluation. So this is a popular program that postgraduates from all over the country attend this. We conduct a yearly workshop and also engage with them online. And continuing with that philosophy, even at Manoshanti, all our staff undergo periodic trainings to ensure that they're updated with their skills, not only with the recent advances, but also it's important to keep revising and with your basics of these precisely these factors that you said, that how the communication skills and these essential skills of being empathetic should be. So yes, so that's a very important philosophy of what we do at Manoshanti. Training is an important component of it.
Wonderful. So now you touched upon multiple, without going into detail into the services and the philosophy that you have, which you already spoke about. Now, what are the differentiators of Manoshanti do you personally see in a day-to-day practice? Now, I'm talking about very application based in terms of day to day, because that's really what it is. Yeah, while you have your philosophy and your processes, but what matters is how you actually inculcate into your day to day running and operational, and that becomes a part of your culture. So a little bit on that. What is compared to maybe other hospitals or clinics which offer the same, right? What is the differentiator that you see in an operational aspect, not just in the philosophy?
Right. So, what we believe is that the experience that the individual coming to us to seek help, right from the point that they get in touch with us and till the time they achieve the recovery. So in all our centers, we provide an ambience which is quite comforting and open. So none of our centers look like a typical hospital or a typical clinic field. We try to provide an ambience which is like a homely, informal kind of an environment. Even our consultation rooms are not the typical rooms where you will have a doctor sitting across a patient and interviewing someone. So we provide a very kind of a homely and very an informal environment where the person can feel comfortable. And the whole the consultation process, as I said in the beginning, that giving time is something which is very important. So giving that dedicated time in their slot wherein they can feel heard and having been listened to, that is and which makes the person feel comfortable. So giving time is something which we ensure in our consultation process. And besides that, as I said, that we take a holistic view of the individual, looking into all the factors that may contribute to the individual's condition, not just the individual, but also their environment and also their own journey that they've had in their life. And we also supplement all our clinical evaluation with psychological assessments that give us a deeper understanding of the individual. And in terms of the treatment process, we believe that all the any latest and advanced treatments available anywhere in the world should be available in our centers to our clients, and everything should be available under one roof, so that the people don't have to kind of shuttle between different people to get different types of mental health treatments. So these are, I think, some of our USPs that differentiates us from, and that's something that we have to offer.
Okay. Yeah, a little bit more about Manoshanti's business. I know you have multiple centers, like we discussed. Like you mentioned, we have around 9 centers in around 4 cities. So a little bit of talk about Manoshanti's operations across India. Where are the centers, and how many doctors you have? What are the specializations? So what all you cover? So just a little bit about the business.
Yes, as you mentioned that currently we have 9 centers across. So we are based out of Pune, Bangalore, Hubli, Dharwad, and recently we have opened a center in Mysore. So in Pune we have 3 centers. So we have 2 adult centers, one in Baner and Koregaon Park, and in Baner we have one more center which is a child development center. Similarly, in Hubli and Dharwad, we have one center each, which caters to again both adults as well as a child development center. And in Bangalore, we are based in HSR layout, Vajrahalli near Kanakpura Road, and in Sadashiv Nagar, where again all these centers cater to both all the age groups. Right. So our at each of these centers we have a strong team of both psychiatrists as well as psychologists and child psychiatrists and child psychologists, by which we are able to cater to all the age groups. And we're proud to have associated with us Dr. Vivek Benegal. So he is a former professor of psychiatry at National Institute of Mental Health and Neurosciences, and he was also there working with the Center of Addiction Medicine. So he is an expert in substance abuse treatments, and so he also consults with us, and we are very happy to have him on our team, and he kind of guides us with establishing protocols for substance abuse treatment. So similarly, we have established protocols for all treatment and evaluation of all other clinical conditions, also such as the stress-related conditions and the various childhood conditions, and as well as old age dementia also.
Great. Now, let's come to you, right? I think it's a little bit about the human touch. So, Dr. Rishikesh, what motivates you the most about your work?
Yeah, I think that's a philosophical question. So, yeah, I mean, let me start with how I got into this field of mental health. So I got interested in this field when I was actually doing my internship after MBBS. Right. So during when we are doing our MBBS, we are all enamored by the fields of medicine and surgery. For us, they are like the top doctors. We want to emulate them. But what I realized during my postings in medicine is that there is a subgroup of patients who were not treated by the physicians, and they would refer these subgroup of patients whom we today we understand them as having functional conditions. That is, they have symptoms which mimic physical conditions, but they are not physical conditions, but they are mostly mental health related. So at that time where I used to work, the psychiatry OPD used to be on the floor above the medicine OPD. So then the physician would signal to us, so they refer this patient up, because this is some. And so I got the impression there is a subgroup of patients whom even physicians cannot treat, and they require this is something which requires a higher order kind of a specialist or an intervention that is required. So that's how I got interested into this field of mental health. And then when I had my psychiatry posting, I saw that the field of mental health is a mix of not only medicine, but it also it requires a lot of human touch, as you rightly said, in treating, because you need to understand each individual as a person and not treat just the condition, but understand the individual as a whole. And that is something that really attracted me to the field of mental health. And that time also came across one of the sayings of William Osler, who said that only the best physicians can become psychiatrists. So meaning to say that it's not just medical knowledge, but it's also that human aspect, that empathetic aspect that is required. So that's how I got interested into this field of mental health, and that is something which has guided me throughout. And that is, I think, my greatest motivation to work in this field of mental health. That is not only treating the condition, but also making a difference to the individual's life.
That's a very, very impressive journey. So, as one of the foremost experts in this field, what message would you like to give to someone who is hesitant to reach out? I think we covered why, when we should reach out, what happens when somebody does, but quite frankly, it's the first step that's the big step. So, what message would you like to give for people who's hesitant, somebody who's hesitant to reach out?
Yeah, I think the most important message is that having emotional distress or mental health distress does not equate to any kind of weakness. You know, a lot of people perceive it as a sign of mental weakness, that I am not able to handle stress, or I am not able to handle the condition myself. Why do I need to reach out and seek help? The fact that I am having to seek help means that there is some weakness. You know, so that is the primary barrier that I see, which prevents people from reaching out and seeking help. Right. So. I mean, an example that I give a lot of people is that, for example, if you've fallen into a pit, you know, how much ever you may try to jump out of it, it may just be too high for you to kind of reach out. You know, unless somebody throws you a rope and then you use that rope to climb out. But that does not mean that that it is in weakness. You know, I mean, there are some times where when people require some help or require some support, and so having to take that help and support is not something which should be viewed negatively. So that's one important message that I would like to give. And second is to be aware that mental health conditions exist. They are on par with physical health conditions. Just the way we talk of our body, we need to talk about our mind as well. Just the same way there are diseases of the body, there are diseases of the mind, and both coexist. There is an interrelationship between the two, and we have to accept that there are diseases of the mind as well, and having a disease of the mind does not mean that there is a weakness or that help is not available. And just the same way that we would take steps to keep our body in shape, we need to take steps to keep our mind in shape also. And there is no health without mental health.
That's such a wonderful message. Have you seen? I mean, you in all your experience, in more than a decade of your experience, have you seen increase in patients now being more comfortable approaching doctors for mental health? And the second question, as an addition to that, is which category of professionals, or patients, mental health professions, maybe it's childcare, a marriage, relationship, or lifestyle, whatever, which category you think is at risk right now? And so you're seeing higher incidence of such segments or category of people approaching you for mental health?
Yeah, so I think with time over the decades, I mean, I have definitely seen that the acceptability of mental health definitely is improving. More people are coming forward to seek help. More people are realizing that mental health conditions exist, and it's not taboo to reach out to a mental health professional. So that is a change that is definitely happening. A lot of COVID has actually accelerated that process. You know, during that whole experience of COVID has helped people realize that the importance of mental health and reaching out and seeking help. What I am also observing is that a lot of people from a younger generation, so who are now probably in their early 20s, so in them the stigma about mental conditions is the least. They are people who are okay to approach a mental health professional without any stigma, right? So it's like a generational change that is happening. Right? A lot of times we see adolescents reaching out and saying, telling their parents that take me to therapy, I want therapy. Right? And it is the parents who are of our generation are unable to understand that, and they tell that कि ऐसा क्या है कि मुझे नहीं बता सकते हो, आपको थेरेपिस्ट से बताना है. Right? So that it's like a generational change that is happening. So there definitely is that change. And at risk population, if you ask me, I think every age group has its own risk. For example, if you start with the elderly, right, just for the fact that because we have good treatments for hypertension, diabetes, we are able to prevent a lot of the complications. We see people are living longer, so so age itself is a risk factor for cognitive problems and dementia. So we are seeing increasing incidences of dementia and depression. And if you look at the adult population, the kind of lifestyle that we are leading today, the overexposure of the social media, constantly having to live a life on being on the edge and dealing with stresses, that automatically puts them at higher risk for conditions such as anxiety and depression. The same thing goes with adolescents as well. The very kind of competitive environment that they have to compete with. A lot of their, in our generation, probably things were much easier than what this current generation of adolescents have to deal with: peer pressure, again, social media. When it comes to younger generations, children, again, there we are seeing a lot of again, to do with excessive things like such excessive gadget use, with increase in nuclear families and reducing social support, right? So what I mean to say is that every age group has its own risk factors and has own challenges that they have to deal with, that put them at risk for higher incidence of mind-related conditions.
Yeah, I think you made a very important point that at least today's generation is pretty much not hesitant, and they're pretty much aware of a condition, and they are more willing to seek help than maybe uh, people of early generation, our parents and grandparents generation. I think that's a very positive thing in many ways. Now, I think we are at almost the end. This is the last question. I think it's been a great discussion, Dr. Rishikesh. Just one thing. Uh, what do you want every patient to remember about mental health, and what long-term habits or lifestyle changes do you encourage? You spoke about diabetes and sugar and all that maintaining, but generally, what would be the best advice you could give uh, for someone who wants to take care of their mental health?
Yeah, I mean, this is something that I tell each of my clients, that there is no problem which is unsurmountable, and it requires some time and effort. So if you identify kind of a mental health issue that is there, maybe some issues are can be fixed more easily than others, but everything can a solution can be worked out. So it requires a time and effort. So we have to be willing to put in that time and effort to find the solutions and be hopeful of light at the end of the tunnel, if you have to say that, right? So that's an important message that everybody who seeks mental health support should have. And the second thing is that be open with your mental health professional. Any kind of a doubts that you may have, or anything that you feel that something should be done differently, be open and discuss it with your mental health professional. A mental health professional would be more than willing to engage with you in that discussion. And your second question about lifestyle changes. Yeah, I mean, we need to inculcate an approach or a change in our mindset in terms of being more accepting of things around us. In general, what we are seeing today is that people like that patience levels are going down. People get emotionally upset very easily. Uh, People's attention spans are really going down, especially with this social media. Nobody can sustain their attention more than a couple of minutes. We are that constant flicking of the thumb and doom scrolling is actually putting people into a zone which is actually making them very restless and impatient. That is a general change in the society that we are seeing, and that is not good for mental health, right? So we need to inculcate patience. We need to inculcate balance. We need to inculcate uh, that philosophy of having to let go certain things, not having to emotionally react to anything and everything that happens around us. I think these are some key changes in our perspective and thinking that we need to bring about. And besides that, I think the importance of physical health on mental health cannot be underemphasized. So having a good physical health also leads to a good mental health. So it has been shown that having a regular physical activity routine, exercise, is very important for maintaining good mental health. Having a good balanced diet, wherein you get your all your required nutrition, vitamins, minerals, and avoiding the so-called junk foods, increasing your protein intake in your diet. So those same advices that help for physical health are also very important for mental health. So overall, it's like, so the key word I think to emphasize is to have, to have moderation and balance in everything that you do, and that's, I think, very important.
That's so refreshing, and I think you really brought up very important point. I think the social media, I think, is something which I think resonates a lot. I mean, that's maybe a necessary evil, as I always call it. But yeah, I think all important points. Thank you very much, Dr. Rishikesh. It's been a wonderful discussion. I think you brought forward some very important points of about mental health and how do you should approach it, what kind of care is available at Manoshanti, and I think that I wish you and the Manoshanti team all the best, and kudos to all the great work you have been doing. Thank you.
Yeah. Thanks, Ketan. I think it was a very enriching conversation. Thank you for having me.
Bye.